sternocleidomastoid. The origin is right here at the sternum and over onto the medial clavicle and up into the temporal bone at the mastoid process in the superior nuchal line. Unilateral helps you look to the opposite side. Bilateral, it helps you look down for cervical flexion, and it helps elevate the sternum. To passively stretch, I'm going to have her look to the side and slightly up, and then I'm going to place my hand on her shoulder and push her into the stretch a little bit more. For the upper traps, you can go from, it's at that external occipital protuberance, and you go down into the medial 1/3 of the superior nuchal line and ligament down to the spinous process of C7, and then it works its way up into the acromion right at the tip of that shoulder, and then the medial aspect, and then lateral aspect of the 1/3 of clavicle. Okay, and then right there. And then action, it helps upward rotation of the scapula and elevate your scapula as well. So it elevates the scapula and also upward rotation. So as you can see that she just did, and then to stretch it, what we can do is have them relax and push them down to one side, and it's stretching the fibers all over here. Levator scapulae, it originates at the posterior tubercles of transverse processes of the first 4 spinous process, and it goes down following my fingers into the medial border of the scapula from the superior angle of junction and the spine of the medial border of the scapula. And this is used to raise the medial border of the scapula. The action is to raise the medial border of the scapula, so we're going to show you that. You can have them put their hand behind their back and find the medial border, and she's going to go ahead and lift her arm, and it shifts this way. And then to stretch it passively, I can have her look to one of the side and down, and I can push her down in a little bit while stabilizing at her shoulder. The supraspinatus originates at the supraspinous fossa of the scapula and inserts at the superior facet of the greater tubercle. And to find the greater tubercle, you can internal and externally rotate their arm. The supraspinatus abducts the arm and internally rotates the arm. To stretch the supraspinatus, she's going to put her arm behind her back, and I'm going to grab onto her wrist and stabilize at the opposite shoulder and pull towards myself. The infraspinatus originates at the infraspinous fossa of the scapula, which is right in here, under the spine of the scapula, and it inserts at the greater tubercle, which can be found by internally and externally rotating. And for this, it externally rotates and also stabilizes humeral head in the glenoid cavity. To To stretch this muscle, it's like the supraspinatus, but in the front. So she's gonna put her arm and cross her body, and I'm going to pull. Our next muscle is teres major. It's on the posterior surface of the inferior angle of the scapula, and it inserts into the medial lip of, sorry, I can't find it. All right, the medial lip of the intertubercular groove of the humerus. And you can also internal and externally rotate to feel this. The actions of this muscle are to adduct, extend, and medial rotation of the shoulder. To stretch this muscle, I can have her lay on her back, put her arm above her head, bent, and press on her elbow lightly until they feel the stretch. Teres minor origin is at the posterior surface of the scapula and inserts on the greater tubercle. Internal and external rotation to find it, and this helps with lateral rotation. Do it again. Okay. To stretch this muscle, I'm going to stabilize the scapula, abduct her arm, and do a little bit of internal rotation and press down. For pec major, it is originating at the medial half of the clavicle, down the sternum, and down to the 6th costal cartilage, first 6 ribs, and then it's going to insert at the lateral lip of the bicipital groove on the humerus. And the action of this muscle is to adduct, flex, and medially rotate of the shoulder. To stretch this muscle, we're gonna do the opposite of the action. So she's gonna abduct her arm. I'm gonna stabilize at the joint and push back into extension. Next muscle is pec minor. It originates at the 3rd through 5th ribs under pec major. Minor is right here and inserts on the coracoid process of the scapula, and it stabilizes the scapula by drawing it inferiorly and anteriorly against the thoracic wall, and it helps you when you breathe in. It raises your ribs. To stretch pec minor, I'm going to have them, your patient put their arm out behind their back in extension, and then I'm going to stabilize at the joint, push back, and pull down. From the side, it should look like this. Serratus anterior originates at the outer surface of the 8 or 9 ribs and goes over and inserts on the medial part of the scapula on the costal aspect. And then for the action, it's going to help stabilize the scapula and protract the scapula, while also assisting in upward rotation. All right, for this stretch, have them on their side, laying down, and then they're gonna put their arm above their head, and you're gonna protract the shoulder the scapula forward, and then push down on the joint with the arm. And you can see it's pulling the stretch through here. Okay. Rhomboid major originates at the spinous process at T2 to T5 and inserts on the vertebral border of the scapula between the inferior angle and the spine of the scapula. And for the action, it retracts the scapula and does downward rotation for your scapula. To stretch the rhomboids, it's hard to get just major and minor by itself, but you can have them sit down, cross their arms, and go lean down. And with her arms extended, you can go ahead and just push them into the stretch a little bit more. For rhomboid minor, it's on C7 to T1. And inserts on the medial border of the scapula, right there. And this also retracts the scapula, which is bringing your shoulder blades together, and it depresses the glenoid cavity and fixes the scapula on the thoracic wall. To stretch rhomboid minor, it's the same as rhomboid major. You're going to have your patient sit down, cross their arms. While their arms are extended, bend down, and you can go ahead and push them a little bit deeper into the stretch. The latissimus dorsi muscle originates at the spine of the sacral lumbar, the lower thoracic vertebrae and iliac crest and bottom 4 ribs. So this muscle is coming down and out like this. So I'm gonna palpate. And the iliac crest as well down here. Palpate up. And it goes into the intertubercle bicipital groove of the humerus. And this muscle, its action is to adduct, extend, and medially rotate the humerus. And it also helps retract the scapula, bringing the shoulder blades together. To stretch the latissimus dorsi, you're gonna have your patient lay down on their stomach and then go ahead and lift your arm in front of you, either one, okay? And then you're gonna internally rotate, stabilize at the joint, and pull towards you. And the stretch will be coming up here. For the latissimus dorsi muscle, if you cannot feel the stretch that was played before, you can have them put their arm out in front, more medial rotation, and more pull. The biceps brachii have 2 heads, the short head and the long head. The short head originates at the coracoid process and inserts on the radial tuberosity. And the long head is deep in the supraglenoid tubercle, but we can still palpate the belly of the muscle. Down and inserts into the radial tuberosity. The action of this muscle is to flex the elbow, flex the shoulder, abduct the shoulder, and supinate the forearm. Because the biceps brachii is a flexor muscle, we want to put them in max extension, stabilize at the shoulder, and pull back until comfortable. Triceps brachii has 3 heads to it. There's a long head, which originates at the infraglenoid tubercle. And inserts at the olecranon of the ulna. And the lateral head is originating at the superior radial groove of the humerus. And inserting at the olecranon of the ulna, and the medial head is deep to long head and the lateral, and it originates at the inferior radial groove of the humerus. And inserts at the olecranon of the ulna. All of these muscles come to the elbow in one tendon and extend the elbow. To stretch the triceps, what you're going to have your patient do is flex the elbow, flex the shoulder, and push them deeper into flexion of the shoulder. The next muscle is brachialis. It originates at the lower part of the humerus and inserts on the coronoid process and ulnar tuberosity. And this muscle flexes the elbow. To stretch this muscle, you can have your patient extend their elbow, and then you passively take them back into further extension. The brachioradialis originates on the lateral supracondylar ridge of the humerus and inserts on the radial styloid process of the radius, and then this is used to flex the forearm at the elbow. To stretch this muscle, you can have them extend their hand and arm and bring them further into extension. The next muscle is flexor carpi radialis, which originates at the medial epicondyle and inserts on the metacarpals 2 and 3. And this muscle flexes and abducts the wrist. To stretch this muscle, keep their arm extended while you flex their wrist and fingers. The flexor digitorum superficialis, the humeral ulnar head, originates at the medial epicondyle and the UCL in the coronary process of the ulna. And then the radial head is originating at the superior half of the anterior border of the radius, and it inserts down at the phalanges 2 through 5 at the middle. The action of this muscle is to flex the PIP joint for 2 through 5 phalanges. And to stretch this muscle, down at the fingertips, extended elbow, flex it back and extend.
So the flexor digitorum profundus, the origin is the anterior, medial, and proximal 3/4 of the ulna, and then it goes down and inserts into the base of the distal phalanges 2 through 5. The action is to flex the distal interphalangeal joints 2 through 5. And then to stretch it, you're just gonna put them in elbow, wrist, and finger extension, and then just hold it there. The flexor digitorum profundus also aids in wrist flexion. Okay, so the extensor carpi radialis longus originates at the lateral supracondylar ridge of the humerus, and then you follow it, and then it goes to the base of the second metacarpal. The action is to extend and abduct the wrist, and then to also flex the elbow. And to stretch this muscle, you're gonna have them go into wrist flexion, and then you're gonna push them further into it and just hold it there. Okay, so this next muscle is the extensor digitorum. It originates at the common extensor tendon from the lateral epicondyle of the humerus, and then it goes and inserts all the way down to the base of the middle and distal phalanges 2 through 5. And the action is to extend phalanges 2 through 5, and then to extend the wrist. And then to stretch this muscle, you're gonna have them into wrist flexion and just push them into the stretch. Okay, the next muscle is the gluteus maximus. The origin is the edge of the sacrum, the coccyx, the posterior iliac crest, sacrotuberous, and the sacroiliac ligament. And then it goes and inserts into the IT tract and the gluteal tuberosity. And then the actions are to extend the hip, laterally rotate the hip, abduct, and adduct the hip. Okay, to stretch the gluteus maximus, you're gonna have them lay on their backs, and then you're gonna have them flex their hip, and then you're gonna push them into hip flexion, and then slight rotation. And then you're gonna hold them into this position. And slowly come back. Okay, the next muscle is the gluteus medius. The origin is at the gluteal surface of the ilium, posterior and anterior gluteal lines, and just below the iliac crest. And then it inserts at the lateral aspect of the greater trochanter. And then the actions are to extend, laterally rotate, abduct, adduct, and flex the hip. Okay, so to stretch the gluteus medius, it's going to be just like the maximus, but more rotation. So you're going to have them flex and then rotate more. Okay, so the next muscle is the piriformis. The origin is the anterior surface of the sacrum, and then it's going to insert at the superior aspect of the greater trochanter. And the actions of the piriformis are to abduct, flex, medial and laterally rotate, and extend the hip. To stretch the piriformis, you're going to have them flex at the hip for both legs, and then put one leg over the other, and then she's going to grab this bottom leg, and then you're just going to push them further into the stretch. Okay, so the next muscle is the iliopsoas. The origin is going to be the iliac fossa. So you can find the iliac crest and just go in. And then the bodies and the transverse processes of the lumbar vertebrae. And then the insertion is the lesser trochanter. So you're gonna rotate the leg and then find the greater trochanter, and then once you rotate out, you'll be able to feel the lesser. And then the actions are to flex and laterally rotate the hip. And then to stretch this muscle, you're gonna have them get up and go into a lunge position. And then you're just gonna push them further into the stretch. Okay, this next muscle is going to be the tensor fascia lata, and then the origin is going to be the iliac crest into the ASIS, the posterior aspect of the ASIS, and then it's going to go all the way down to this long tendon into the iliotibial tract, and then the actions are to flex the hip, medial rotate the hip, and also abduct the hip. And to stretch this, you're gonna have them go onto their side. And this top leg back that we're stretching, you're gonna have them hang off the table. Keep them straight. And then you're just gonna push them into this stretch. And you're gonna go. Okay, so this next muscle is going to be the rectus femoris. The origin is going to be the AIIS, and then it's gonna go down and then insert at the tibial tuberosity. The actions are going to be flex the hip and extend the knee. And then to stretch this muscle, you're gonna have them get onto their stomach and then push their heel into their butt. All right, so this next muscle is going to be the bicep femoris. The long head inserts at the ischial tuberosity, so with the heel of your hand, you're just gonna do that. And then the short head inserts at the lateral lip of the linea aspera on the femur. And then those two muscles, like two parts of the muscles, go down. And it's going to insert onto the head of the fibula. And then the actions of the bicep femoris are to flex and extend the knee, as well as laterally rotate the knee, and laterally rotate the hip, and also posteriorly tilts the pelvis. And then to stretch this muscle, you're gonna have them flip onto their back, and then they're gonna flex at the hip, and then you're just gonna push them into hamstring stretch. So this next muscle is going to be the semitendinosus. And with the heel of your hand, you're gonna feel the ischial tuberosity. And then you're gonna follow that muscle all the way down into the pes anterior. And then the action of this muscle is going to be flex and extend and laterally rotate the knee, as well as laterally rotate the hip and posteriorly tilt the pelvis. So to stretch this muscle, you're gonna have them flip onto their back, and then you're gonna do hamstring stretch like before, but you're gonna have your foot internally rotated. Okay, this next muscle is going to be the semimembranosus. Then with the heel of your hand, you're going to feel the ischial tuberosity. And then that is going to follow and insert into the medial condyle of the tibia. And then the actions are going to be flex and extend the knee and laterally rotate. And then it's going to laterally rotate the hip, as well as a posterior tilt of the pelvis. And then to stretch this muscle, you're gonna go onto their back, and then they're gonna have their foot everted, and then you're gonna do a hamstring stretch. So the next set of muscles are gonna be the adductor muscles, and it's gonna be the adductor magnus, longus, and brevis. So the magnus originates at the inferior ramus of the pubis, inferior ramus of the ischium, and the ischial tuberosity. The longus is the pubic tubercle, and the brevis is the inferior ramus of the pubis. So to help with that, I'm just gonna have them put their hands across and then push down on the ramus of the pubis, and then we're just gonna from there, you're just going to palpate into the pectineal line and the medial lip of the linea aspera. They all insert in the same area. And then the actions of this muscle are to adduct, medially rotate, and flex the hip. And to do this stretch, you're going to have them get into the butterfly position, and then you're going to push down on their knees to get them deeper into that stretch. Alright, so this next muscle is going to be the gastrocnemius. The origin of it is going to be the condyles of the femur. And then it's going to go down and insert at the calcaneus. And then the actions of this muscle is going to flex the knee and plantar flex the ankle. And then to stretch this, you're going to have them flip onto their back. And then with their knee extended, you're going to push their foot into dorsiflexion. This next muscle is the soleus. So the soleus originates at the soleal line, as well as the proximal surface of the tibia and the posterior head of the fibula. And then it goes down and inserts at the calcaneus. And then the action of this muscle is to plantar flex the ankle. And then to stretch this, you're going to keep their knee bent, and then you're going to put them into dorsiflexion. So the next muscle is going to be the tibialis anterior. So the origin is going to be the lateral condyle of the tibia, the proximal lateral surface of the tibia, and the interosseous membrane. And then you're going to go and insert, it's going to go down into the tendon at the medial cuneiform at the base of the first metatarsal. And then the actions are going to be invert the foot and dorsiflex the ankle. And then to stretch this, we're gonna evert the foot and then plantar flex. And hold this position. All right, the next muscle is going to be the fibularis longus. The origin is going to be the head of the fibula, as well as the proximal 2/3 of the fibula. And then it's gonna go down and cross over and insert at the base of the first metatarsal and the medial cuneiform. And then the actions are going to be evert the foot and then to plantar flex the ankle. And to stretch this muscle, we are going to invert the foot and then dorsiflex. So the next muscle is going to be the flexor hallucis longus. The origin is going to be the middle half of the posterior side of the fibula, and then it is going to go down. And it's going to insert at the distal phalanx of the first toe. Here. And then the actions are going to be the flex the first toe, invert the foot, and then it assists with plantar flexion. And then to stretch this muscle, we are going to grab the first toe and then pull it back into dorsiflexion and extension of the toe.